If you're tired of struggling with weight loss or have a hard time remembering things, you might think they're just a signs of aging, but our first guest says it could be an issue with your thyroid.
Welcome this morning, Dr. Tunis Hunt with Hunt for Wellness. Dr. Hunt, good morning. How are you today?
Doing well. Thanks for having me.
We're glad you're here. We're going to talk about the thyroid. First off, what is the thyroid?
Right. Well, the thyroid is a gland that stretches across the front of the throat, around the Adam's apple area. In fact, the Greeks first termed thyroid thyrios, meaning shield. And so it not only looks like a shield, but it acts like a shield in the body. For instance, if you're cold, it heats you up. If you get a virus, it revs up your immune system. It also helps calms us down, when we're under a lot of stress, so we don't blow a gasket. In other words,
we like the thyroid then.
Yeah. In other words, it kind of protects us because it reacts pretty well to anything that happens in the body.
What are some common problems we have with our thyroid then?
Right. Well, some of the most common problems we have is inability to lose weight is a big one. Another one would be cold hands and feet, constipation, inability to think, brain fog, constipation. Unfortunately, the thyroid, when it's not working, can wreak a lot of different havoc on the body.
So that's why the thyroid health is so important.
Exactly. That's why thyroid health would be important. The thyroid is responsible for a lot of metabolism in the body. In fact, every cell in the body has thyroid receptor sites. So if the thyroid's not working, almost anything can go wrong. It's also like the gas and brake of our metabolism. So it helps us either burn weight or store fat. And in our society, unfortunately, a lot of people struggle with that.
And we don't want to store fat.
No.
Okay, we don't. But help me with the difference, because my wife had like hypo or hyper active thyroid.
Right.
And I remember when she was losing weight, she's like, oh, I'm losing weight. But I don't know if that was a good thing or a bad thing.
Well, when it comes to thyroid health, you can have either a hypothyroid or hyperthyroid.
And what's the distinction between
the two? So the hypothyroid is when the thyroid's not producing enough hormones. So we're not getting a lot of thyroid into the body. Hyper is the opposite. The thyroid gland itself is overproducing thyroid. In either case, it's a problem.
Okay, lots of people get their thyroid tested, may even go on medication, but still get the symptoms. Why is that? If they're on medication, how come it's not going away?
Yeah, absolutely. One of the most common concerns we hear from patients is, doc, I've been tested, I'm on medication, my labs look quote unquote normal, yet I'm still struggling with a lot of these problems. And after we talk to them and really evaluate some of their previous labs, what we find a lot of times is just the complexity of their case really hasn't been comprehensively evaluated. And when it comes to thyroid testing, the standard of care is to look at a number called TSH, or thyroid stimulating hormone, and that's released in an area of your brain called the pituitary, and it tells the thyroid to produce hormone. Well, once you really evaluate the complexity of the thyroid metabolism, you'll notice there's a bunch of other things that could be attested that a lot of times aren't, and as a result, people continue to struggle despite the medication. One of it being autoimmunity. It's reported that about 60 to 90% of hypothyroid individuals in the United States actually have an autoimmune disease called Hashimoto's hypothyroidism. And unfortunately, the medications that's often prescribed doesn't do anything for that aspect of your health, and that's why a lot of people continue to struggle despite being on the medication.
My wife was taking Synthroid,
yes,
and she couldn't take the generic Synthroid because that was bad for her, but the other one was good. So is it a matter of medication, getting the medication right when we're talking about these patients?
Well, part of it is, absolutely there's a time and place for medication. A lot of people can respond to medication, but the telltale sign is this. If you're on medication and your labs, quote unquote, look normal, but you're still having the symptoms, then you might need to dig a little bit deeper.
So how do you evaluate someone's thyroid?
Right. Well, first and foremost, we do a more comprehensive evaluation of the thyroid initially. We look at about 8 markers, including some of the antibodies I talked about, to rule out Hashimoto's hypothyroidism. The second thing we understand is the thyroid doesn't work alone in the body. There's other areas of the body that negatively or positively affect the thyroid, one being the adrenal glands in response to stress. Another one being the liver. A lot of conversion of thyroid hormone occurs in the liver and in the gut. And if those two areas aren't evaluated, some people will continue to struggle despite some of the attempt to medicate them and so forth.
That's why we need to talk to somebody like you. You host a dinner?
We do. One of the greatest joys we get as an office is really share as much information as we can with the public. And we found one of the best ways of doing this is offering these free dinners. And what we do locally here in Charlotte is we'll pick a restaurant and we'll invite people to come and listen a little bit more about how they can have their thyroid properly evaluated, how they can do some things on their own to get healthy, and they get a great gourmet dinner as well.
To register for the dinner, visit freedinnertalk.com. freedinnertalk.com. You can also call Hunt for Wellness. The number, we'll put it up there on your screen. It is 704-588-1792. 704-588-1792. Again, freedinnertalk.com, so people can come, get a nice meal, and learn about this.
Absolutely.
Very
We'd love
good.
to have everybody.
All right.
Hunt for Wellness. Dr. Hunt, thank you very much.
Thank you.
All right, still to come on Charlotte Today this morning. A delicious dish that's packed